Have you ever wanted to own multiple dental practices? It was always one of my goals when I was in practice. I thought to myself, if I can just have a couple of more dental offices, that would be just an amazing revenue stream to both me and my family. So how do you go about creating multiple dental offices in order to increase your revenue? Well, the most important thing, of course, is to find dentists to work these offices. And the second most important thing is to create systems within the business framework in order for everybody to have something to reference as you start to grow. Those two things, and those two things alone, are the most important thing in creating a large group dental practice. So if you want to go from one office to two offices, you can't really clone yourself for as much as we like to be able to do that. So what do? You need to find a dentist. And you're going to find a dentist, and probably a younger graduate is a good thing, where you have the opportunity to groom that dentist to kind of create a system where they're going to be able to produce good dentistry. So the first thing is to find a younger dentist and make them an associate. And if they have the opportunity to become a partner in a larger growing group dental practice, that's a wonderful, wonderful thing for a young dentist. But in order to move forward, creating systems and creating policies within your group dental practice is probably the second most important thing. So for example, how does somebody on your team, hygienist, dental assistant, how do they know how often to take radiographs? You have to create a policy for the radiographs, which means how often do you want to take a panoramic x-ray? How often do you want to take a full series of radiographs? How often do you want to take bite wings? Those policies need to be created by you as the CEO or as the president or the owner of this group dental practice. Some of the other policies that need to be considered is, when do you treat periodontal disease? So you're going to probe every patient every single time. That perhaps may be your policy. Or maybe you're only going to probe patients once a year. That may be your policy. But at what point do you start treating pockets? Do you treat a 4mm pocket with bleeding? Do you treat a 5mm pocket with bleeding? Whatever your policy, whatever your standard of care is for your group dental practices, between having great dentists and having great policies, you'll be able to create a group dental practice that'll start to grow, and you'll have an enormous amount of revenue because of that. The best part about creating a group dental practice is the value of a group dental practice is far greater than an individual dental practice. Typically, the value of an individual dental practice is somewhere between 65 and 75% of 1 year's gross. As soon as you start creating a group dental practice where you have 4 or 5 or 6 dental offices, now the multiple of the sale is a multiple of the overall growth. So now you may get 3 or 4 times sales for the entire group. And you can see how that multiplier becomes so much more significant than 65 or 75% of 1 year's gross. Please look into it. There's a lot of consultants that will be able to help you. Having a group dental practice is certainly the future of dentistry. Don't be left behind. Find good dentists, have great policies. Those two things together, you'll be able to create an amazing group dental practice.